Thank you. I'm here with Malay Gandhi, Managing Director of Rock Health, an early stage fund for health tech and digital health. I've known Malay in San Francisco, and I'm delighted to see him here in my new hometown of Austin, Texas, here at South by Southwest. Malay, thanks for being here.
Thanks for having me.
What are your reactions to South by Southwest so far?
I'm really impressed by everything that's going on around health tech here. I mean, we're actually sitting in the middle of a whole expo dedicated to health tech companies. This is the first year, my understanding, of South by dedicating a whole area of the conference to health tech. And the entire hotel, this hotel that we're in, has been running health tech sessions since the interactive began. So I'm pretty impressed by what's going on here.
Great. So big data is the name of this particular talk, but we're going to veer away from that in a moment. But before we do, what does big data mean for you? What have you seen that really brings some of the excitement around big data to life in a product?
I think the way we tend to look at it is there's only a handful of challenges actually today in healthcare we would argue are big data challenges. So one of the largest and one of the ones we're most interested in is in the area of genomics. So as the price of full genome sequencing comes down, I think many people know it's dropped by 5 to 6 orders of magnitude over the last 10 years. The thing most people don't know is also that the velocity of the output, so when you look at the sequencers, how much data they can produce each day, has also increased by 5 or 6 orders of magnitude. So you have something that's becoming a lot cheaper, and then we're getting a lot more of it. So we're talking about 15 gigabytes per exome. So this is a serious big data problem. And so it's one of the areas where we're most fascinated by. Frankly, most of healthcare doesn't have data issues this big. If you're processing claims files, which is what health insurance companies do, even if you're looking at electronic health records, there's not that much data there. But when you start looking at the genome, there's a lot of data, and that's when we want to see all these great big data technologies like what Cloudera makes, building on Hadoop, used in the healthcare system.
Great, and so this is the kind of big data that can help us with precision medicine, for example. Is that right? And do you see any new technologies come out that may bring precision medicine to life and actually show its value?
Yeah, so the way I tend to look at it, precision medicine is an interesting term. We kind of encapsulate all of it under this nomenclature of personalized healthcare. And I think the reason why is because we want to get around the idea of viewing everything as medicine. So our health exists beyond our relationship with the physician. It's really about our overall health. And absolutely, your genome and all of your omics, whether it's your metabolomic profile or your proteomic profile or your microbiomic profile, fits in. But so do all of the other physiological metrics that we're able to capture now through sensors. And all of this needs to form a picture of a patient and how do we really diagnose them and then treat them properly. And that could be a wide range of things that are oriented in the traditional medicine system or outside of it.
That's great, because that aligns with some of our conversations at the new Dell Medical School, where we've said that precision medicine is a step in the right direction, but we really should extend beyond to what we're calling precision health. And again, similar exactly to what you're saying, so where the outcome is health. And let's think about all the data sources that we can use within the body as well as outside of the body so that we improve care at the point where the physician is really talking to the patient.
Absolutely, and I think the big difference for us is the difference between saying like, the old model was right drug, right patient, and we just say right the best thing at the best time for the patient. Like we're going to make the best decision we can using as much data as available, because realistically, health is way more complex than any single data point, including our genome.
Great. So what would you recommend for a brand new medical school starting up in a city as vibrant as Austin? Given your experience in San Francisco and given your experience in both the phase of Rock Health when it was an accelerator, now as an early stage investor, what do you want us to do?
Well, I think there's a great responsibility that medical schools have today. You have some of our best and brightest who are entering the profession, hopefully to make a really big impact in patients' lives. And I think the one thing that's been very frustrating to watch, I'm not a physician, but just talking with them and seeing it and looking at sort of the surveys of physicians is how much dissatisfaction there is with the profession. And I really worry about that. The idea of practicing medicine was something that people are drawn to because they care about human beings and they want to provide this care for them. And they're being forced to spend a lot of their time fitting into a healthcare system that's fundamentally broken, that asks them to document every encounter into these complex electronic health record systems, by the way, which then pop up 100 notifications for every action you take. And then also treat the patient to support whatever billing system. And so if there's one thing I'm very passionate about is how can the schools return joy to the practice of medicine. And I think the way to do that is to help the students have some freedom to be creative and think about how medicine is going to be practiced in the 21st century and getting out of the molds. Because honestly, as a health tech investor, I could say the technology today is not physician first. So if you can provide a ground for your students to really explore the practice of medicine and how do we create better tools for doctors to improve the quality of care, which as I understand is the #1 driver of job satisfaction for physicians, they're the users. We really want to see them as the people who drive the solutions forward. And so I'm very excited to invest in companies that say we are a physician-first company, not a payer-first company, not a hospital-first company, not an administrator-first company, but deeply care about the experience of physicians in the practice of medicine.
That's perfect. That's almost like our mission statement. You can come here anytime, Malay. But lastly, I wanted to ask you, I still remember sitting in your offices in San Francisco. You have these beautiful glass-walled offices now overlooking UCSF, my alma mater and where I came from before I came here to Austin. And I remember sitting there, and at that time I was talking to Hallie and talking about the relationship between Rock Health and UCSF, a world-leading health institution. And that conversation sort of exposed some of the fundamental challenges in bridging the gap, even though the gap there literally was a road and a glass wall so you could see the cancer center in that case, and yet it seemed eons away.
Yeah.
We have a chance here as a brand new medical school to redefine how we interact with the world around us, be it the world of business and certainly the world of our community. What can you share with us about things that we should do, things that we should not do as we re-envision what our relationship is to the world beyond us?
I mean, we've worked with a number of organizations over our life, in the corporate side, provider and medical organizations, institutions like UCSF. And I would say that the two biggest things that I've learned from these experiences, number one, it really does start with leadership. And I don't mean that to be a cliche, but the question has to be at the highest levels, how important is this to us? And everyone in the organization needs to have the freedom to operate and move and take risks and do things that are aligned with the organization. But the minute any staff person or somebody below the leadership level feels, hey, if I take a risk, I could be left out to dry, they're not going to take those risks. And ultimately, working with early stage companies, partnering with Rock Health, is a risky activity for people. We invest in very early stage companies that probably don't have full validation of what they're doing yet. So I think number one, it starts with leadership and giving people a protected area by which to innovate and think about partnering with early stage companies. The second thing, very selfishly, I want our partners to be very organized in how they interact with us. So, and by organized, I mean, what is the purpose of any interaction you're having with one of our portfolio companies? Do you have a defined process by which you think about, here are our priorities and needs at the highest level? And I encourage you to think about that as we have 2 or 3 needs per year, and tell us what they are, tell these other organizations what they are. And so when you meet with companies, you know immediately whether they're a good fit for you or not, but then what happens to them? How do you work with these organizations? And I think specifically in the provider and medical realm, what we're looking for today are the most forward-thinking, leading, innovative healthcare systems, medical schools, provider organizations, who will help us validate that these technologies work. I think there's still a big open question, what's benefiting people or not? I mean, if we walked around here, how many people do you think have published research about what the effect of all these technologies are? And we take that mission very seriously. And so our partnerships with provider organizations today are based on the idea we need to build validation sites, not just at academic medical centers, but also at community hospitals, geographically distributed, serving very diverse patient populations, and understanding whether these things are working or not. And we have a responsibility to publish the things that don't work, even if they're our own companies.
Well, that's great, Malay. Thank you for your time.
Thanks.
Great.